Distinguished ESG lecture. I'm Daniel, Senior Manager at the Institute and your MC for today. Before we start, I'd just like to introduce today's host, the HKU Jockey Club Enterprise Sustainability Global Research Institute. It was established in June this year by HKU Business School, funded by the Hong Kong Jockey Club. It's dedicated to top-tier ESG research, education, and forging partnerships. We have many exciting events and initiatives upcoming, so please stay tuned by subscribing to our social media channels. Today, we have an exciting agenda lined up featuring esteemed speakers and a panel discussion that promises to be both engaging and insightful. Without further ado, may we please invite first welcoming Professor Gordon Charlie, Director of the ESG Research Institute, for welcoming remarks. Professor, please. Agenda lined up featuring esteemed speakers and a panel discussion that promises to be both engaging and insightful. Without further ado,
okay.
Please invite.
Thank you. Thank you very much for attending this event. This is our second distinguished lecture series, and today we're very honored to have Professor David Cutler to give us a talk. But before we move to the more substantial kind of content, I would like to take a few minutes to introduce our institutes and some of the activities we're organizing in the coming months. So I think this is not. Is it working? Oh yes. Okay, good. So to start from, I just want to re-advertise our first school-wide ESG research, ESG or sustainability report, which summarizes some of the key numbers of our kind of commitments and efforts trying to promote sustainability. Right. So now our school have more than like 30 plus ESG related courses, and we're soon launch a new master program on sustainable finance and accounting. And right now, we publish more than 50 ESG related papers on top journals, and which place us to be ranked number one according to UT Dallas Top Business School research rankings in this region. And we also are committed to providing community services with those are numbers, almost 150,000 hours of work to support more than 50 social impact organizations through our impact lab. We also have right now some statistics. So about 60% of our students are female, and around like 30% of faculty members are female. And besides, we also did some calculations about our carbon emissions. I think we are now starting from scope 1 and scope 2. We are emitting last year 3,800 tons of carbon monoxide equivalent. But in the future, we are going to work on scope 3 and trying to bring down those numbers. Last but not least, that's our institute. We really try to engage more stakeholders to join this initiative to promote sustainability. I would not spend time on our past events, but I do want to highlight two things that we are going to do next month. Next month. So we will have been co-organizing an ESG forum with Hong Kong EJ on November the 8th. And after that, we are going to have another major initiative in which we are going to invite Jane Goodall, who is legacy in kind of biodiversity conservations and many other things, right? So she is going to turn into 90, and she's coming to Hong Kong, where we are going to organize a forum for him. And during that forum, we are going to be discussing biodiversity. So, re-advertise. Okay, try to follow us on social media. And today, we have lineup a series number of very distinguished speakers. The keynote speaker today is Professor David Cutler, who is a leading expert in health economics and health policy. His work, I don't want to emphasize too much, but he really bridges the gap between economics and health professionals and health policies. And he's also kind of providing a lot of consultants and advising things to policymakers. He was a former White House healthcare advisor He also was an economic advisor of the White House for different terms. And recently, he published a new book, Survival of the City, Living and Thriving in an Age of Isolation. So today, Professor Cutler will bring his insights on this topic to Hong Kong. Besides Professor Cutler, we also have a lineup of panelists. Here are their names. So we have the honor to have Professor Sophia Chan to join us. She's now the Senior Advisor and President Office and Professor of Director of Hong Kong U Primary Health Care Academy. Before this appointment, she was the Secretary of the Health and Food Department. And we also have Professor K.S. Wang, who is now kind of part-time and working with Hong Kong U and for the Faculty of Architecture. He was also former Secretary of the Bureau of the Environment. So we are very honored to have former leaders in both environments and healthcare to join our discussions. Aside from that, we also have Mr. M. Kalen, who is the Director of Sustainable Design of Ronald Lu and Partners. He is going to share with us the insights of the architecture and the building designs. We also have Professor Eric. I don't know whether I can pronounce that name correctly. Shudefri, is that right? Okay, so good. So he's an associate professor in the Department of Architecture, and formerly he also serves as the head of Department of Architecture. And finally, we have our today's moderator, John Cloffer. He's an assistant professor in economics department. He works on labor, health, education. So hopefully, we are going to see great discussions on this topic, and I really look forward to today's event. Now let's welcome Professor David Cutler on the stage.
Fantastic, thank you. Well, hello everyone. Yeah, thank you so much for inviting me to be here with you. It's a great pleasure for me. I was thinking the last time I was in Hong Kong was about 35 years ago before this time. The city has changed a little bit in that time. So I'm just delighted to be invited back. Thank you to John for doing the inviting, and to Neil and everyone from the Jockey Club for hosting me here. It's a great pleasure for me. I want to talk to you about sort of drawing from a book that I wrote with my colleague Ed Glazer at Harvard. And the book is on survival of the city. Basically, how do you survive in an, oh, thank you. How do you survive in an era of isolation? And so I want to, and it's all about cities and urban life. So I want to sort of start off by giving you kind of the puzzle that we started off with, and then we can talk about it some. So here's the puzzle. Cities are among mankind's greatest inventions, right? People didn't always live in cities, but when they did, then they grow rapidly. So, you know, the world's urban population keeps increasing, shows no sign of slowing down. And it's easy to understand why people in cities live longer. They used to live less long, but now they live longer. They're happier, and they earn more. So all sorts of activities that people like are better in cities. But cities are very fragile, actually. At least urban life as a whole is sort of very fragile. So if you look at which cities are the biggest in the world, that changes a lot over time. Some of their commonalities, like in the top group, are the Londons and the Parises and the New Yorks and so on, but they grow and shrink over time. And in fact, even the big cities can shrink in addition to grow. You can see London up at the top of the screen, which had been going up, then going down some. You see New York, which is at the bottom of the screen, going down and then before going up some. So cities sort of go through kind of roller coasters. And the question is, how do you think about urban life? How do you think about what makes a city healthy in the broad sense when they're so valuable and yet seemingly so fragile? So that's really the goal of the talk. What I want to suggest is that the fragility is a result of sort of deliberate or random disregard of major problems, and that the key to a lot of urban issues is going to be how to address those problems. And there are two that I want to think about. One is disease, and then second is non-disease factors that in many ways have some of the same implications of disease-based factors. Each of these drives people out of cities and across different cities. And so the role in them is going to be really critical. What I want to do is illustrate some of these, talk about some of the problems that they cause, talk about some of the solutions. Most of my work, as befitting someone from the US, is about the states. And so most of the pictures and things that you'll hear are about the states. I will talk some about Hong Kong. And at the end in particular, I'll give you some thoughts about Hong Kong, which hopefully I can use as a basis for our discussion here. So let me start off the first of these with disease, which is that disease has always had an urban component. So if you look at most of the great plagues in history, they were urban plagues. This is not a picture, but a depiction of the Cyprian plague. There are plagues in Athens and sort of all throughout the ancient world. There are plagues going into the Middle Ages and the Black Death and killed a third to a half of Europe and so on. So disease has always had an urban component. In fact, if you look, most diseases are largest in urban areas. That's because you have to have people together in order to spread diseases, whether they're viral or bacterial or protozoan or whatever it is. You can see that diseases sort of looked like, it looked like they were big and then they were dying out. But on the other hand, if you look a little bit more, actually, diseases are not really dying out, but in some sense, we've just gotten a little bit better at handling them. So until recently, the last sort of very big outbreak was the great flu epidemic of 1918, which for a while in the US, we called the Spanish flu. We mostly called it that because Spain was neutral in World War I and it was observed there first. It's actually the flu is believed to have originated in Kansas in the US. So to give you a sense about where epidemics can originate. But then you see a sort of series of smaller ones which turned out not to be so bad, but in fact were, if you will, a warning sign that we missed, that there were all sorts of kind of viral outbreaks to worry about. The one big one that you don't want to forget about, even past the great flu epidemic, is HIV/AIDS, which was a huge issue, particularly in low-income countries in sub-Saharan Africa, and that again has many of the same features of uncontrolled spread and so on. For a time, though, it seemed like we had solved the urban pandemic issue. So this is sort of mortality rates in New York, and you can see, it would be high or low, depending on the city or different sorts of things. In New York, cholera would have been a big deal. In Philadelphia, in the US, it was typhoid fever, depending on the nature of the weather and the bugs and stuff like that, you had different things. And then we sort of dealt with a lot of those successfully. And we dealt with them successfully the way that countries and cities did deal with things, which is to clean up the water supply and clean up the sewage and make the city healthier. And so therefore people were not as exposed to disease. It's an interesting feature, which I'll come to a little bit later, which is that most of those policies were not actually a sort of, if you will, a conscious act by government leaders, that is the mayor of New York. In the case of New York, what it was the city health commissioner just going to folks who were renting out apartments to low-income tenants and saying, would you like to install clean water and sewage, or would you like us to take away your building? The choice is yours. Which one do you want? And so they wound up getting a lot of water and sewage facilities done that way. So government has always been a sort of huge example here, but oftentimes not government like the elected part of government, but government like the administrative part of government. COVID was bad. So obviously COVID was bad, worldwide deaths you can see there. But actually we got kind of lucky with COVID. And we got lucky in a couple of senses. One is that COVID was not particularly fatal. For example, it was much less fatal than SARS and MERS were. And second is that vaccines were developed fairly quickly. So the shortest time on record from sort of discovering a disease to producing a vaccine for it. Just to give you a sense, treatment of HIV took 15 to 20 years to become something that would turn HIV from a fatal disease to a chronic disease. And this took 9 months. So it's just an enormously shorter time. Of course, counting on good luck is not a great strategy. So the question is, what can we do that was better? But I want to not focus on the COVID part so much because I want to focus on the urban part. So COVID really affected cities, certainly in the US and I think around the world as well. You can see here growth in cities, which was very high, slowed down, actually reversed itself. In the US, where did people go? Well, sorry, before I get that, the sort of classic example is San Francisco. And San Francisco is going to be the example that one of the examples that I'm going to use of how not to run a city well. So San Francisco is sort of had designed itself so that it still had a lot of single family houses. Not a lot of people could afford to live in San Francisco. Businesses were separate from where people were. COVID came and people stayed away from the office. Because of COVID in the US, we had sort of mandatory stay-at-home orders. And then when COVID came back, when COVID subsided and it was time for people to think about coming back, people didn't want to come back to the office because they didn't live close. They lived an hour and a half away, and the commute was very big. And as a result of that, there were lots of areas of the city where there weren't a lot of people. And because there weren't a lot of people, then other people didn't want to be around them because who wants to commute an hour and a half just to be sitting by yourself in a cubicle, which doesn't make a lot of sense to anybody. So vacancy rates in San Francisco are extremely high. They went from under 10% to over 30%. And the city itself does not have much of an active population there because it made it so hard to build housing. So the net effect is that, a lot of San Francisco really looks like, looks very run down. And if you walk through it, you're sort of like, well, why am I here? There's not a whole lot of reason to be here. So that's an example of a city that did very, very poorly. And sort of I want to come back to some of the lessons from that. But where did people go? Well, if you're footloose and you can work commute, where do you go? You go where housing is cheap. You go where your family is. You go where you can have a nicer lifestyle. So what you saw are sort of the growth of kind of second tier cities, what I'll think of as second tier cities. So if you think of the first tier cities in the States as being, say, New York and Chicago and Los Angeles and San Francisco and Boston and places like that, that's not where people went. Those are all extremely house price cities. I'll talk a little bit about why that's so important in a minute, but those are all extremely house price cities. And so where did people go? They would go to Phoenix and Las Vegas and San Antonio and Austin and Charlotte and so on. All those cities that if you are good, you've probably heard of half of them. Like if you're good with geography, you've probably heard of half of them, unless you're sort of spent some time in North America at some point, but probably you haven't been to a lot of them. And that's exactly right, is that you wouldn't have really kind of, from a very cosmopolitan sense, you would not have wanted to have been there for a long time, except if there's no reason to be in San Francisco because you're not actually there and you're living an hour and a half away, and now you can telecommute anyway. So why is it that you need to go there? So this is sort of an example of like a shock that sort of pushes people away. And this, how bad this will be depends on kind of the nature of disease and the disease process and the other things going on in terms of the design of the city and so on. But how bad this is depends on the nature of the process. Now, COVID, as I said, was fairly short. So what we're sort of seeing is kind of the US was affected, but will not be kind of decimated. US urban life was affected, but will not be decimated because of COVID. Nonetheless, it is a real warning sign because you can imagine if you get hit by these again and again and again, then all of a sudden you're dealing with a situation where people are like, look, why do I even want to think about being there when I could be in some other place that's both safer and cheaper? And nice lifestyle and all of that. So one of the major issues on the urban agenda has to be controlling disease, both because of the people who get sick and die in cities, but also because of what it means for the health of cities. That is, take the San Francisco example. Here we are a few years after COVID. COVID is sort of in the rearview mirror of Americans, but it is absolutely still playing havoc with a lot of the areas where we live and work. So how is it that we want to deal with that? So I want to talk a little bit about that here. This is an audience that's obviously more interested in the urban part than the public health part, but I just want to talk a little bit about what this means. And there's a really important urban part in here as well. So I think there are really three strategies to dealing with the disease environment. One is global, one is national, and one is local. The first one, global, which is we need a global alliance to improve health. So the world needs a sort of international scientific organization devoted to reducing the spread of pandemic disease. There are three great crises confronting the world, like everyone in the world. There's the threat of nuclear war, there's climate change, and there's pandemic disease. Of them, the world devotes the most attention to preventing nuclear war, and it's probably the least of the three in terms of like the risks to to human lifestyle. We're now devoting a lot more attention to global warming, thank the Lord. We're still not devoting enough attention to that, and certainly to pandemic disease. So there are all sorts of things that that we need to do. Police countries, monitor what's going on. The monitoring thing is sort of interesting. I was asking someone once, a friend of mine who sort of studies pandemic disease, what kinds of things would you think about if you were monitoring the world's pandemic disease? And his response was, I would look at the price of chicken in Thailand. Anyone want to estimate, anyone want to give an answer for why the price of chickens in Thailand would be really important? How many they have to call? Because if a lot of disease is going to spread through animal populations, it's going to hit chickens, and you'll pick that up by knowing what's happening to chicken prices in markets in Thailand. So like those are the kinds of things that we should be measuring. This is sort of a weird thing to say to an audience in China, which is that our model for disease prevention, for pandemic prevention, is the World Health Organization. Actually, I think the World Health Organization both did not do a good job during COVID, and sort of structurally, it's not designed to do a good job because its funding is so dependent on contributions from donations that countries make. So when China gives a lot of money, it's afraid to criticize China, and it doesn't want to hurt trade with countries. So when there's an Ebola outbreak in West Africa, it doesn't announce there's an Ebola outbreak because it doesn't want to hurt those countries in some way. So here's the ironic part. While I'm standing in China, what we ought to think about is a model more like NATO. So NATO is the alliance that defended the West from the Soviet Union. God forbid it doesn't turn into the alliance that has to defend the West from China. I would hope that would never be the case. But in fact, the NATO is not a sort of political organization. It is a technical organization that was designed to prevent nuclear war against NATO countries, and did extremely well. It's probably the most effective alliance in history. And what we need is something, I think, that looks a little bit more like that than it does like a sort of voluntary kind of system, because voluntary things, there's always a weak point, and that weak point will get exploited. So that's at the global level. Where would you look? The answer is everywhere. I told you where the Spanish flu originated was in Kansas. COVID obviously originated in Wuhan, China. Various outbreaks originated in other places. South Africa got blamed for an outbreak, again, not because it originated in South Africa. We don't know where that particular outbreak originated, but because it was first discovered because South African doctors were fairly alert. So therefore we called it the South African variant. So there were lots of things. You can see here various kinds of trade of viral infections over time. There's nothing, you have to be monitoring the US heartland and Canada and Mexico just as much as China and Thailand and West Africa and so on. The second point is we need better healthcare systems. Okay, so let me say this as an American, which is that the US health response was, quote, haphazard, and haphazard is purposely designed to give at least a little bit of credit to the US where it deserves not that much. Single payer countries did better than multi-payer countries like the US. Interestingly, countries run by women did better than countries run by men. Take that approximately half of the room and half of the global population. Countries with a good public health system did the best. The US does terribly in terms of most healthcare metrics. Many Asian countries have only so-so healthcare systems. And so I'll sort of say this as kind of someone who studies healthcare systems. Let me sort of show you what I mean by good and bad healthcare systems. So on the left is sort of what you think of as the ideal healthcare system. It's got a very strong base of wellness and prevention. It does some routine interventions, and then on top it does a small set of high-tech interventions. And you can screw that up in at least two ways. The first way you screw it up is the US way of screwing it up, which is you have a lot of specialty care, but you don't have a lot of primary care. So 2/3 of US doctors are specialists, 1/3 are generalists. In a quote, good country, 2/3 are generalists and 1/3 are specialists. And even a lot of the generalists in the US actually specialize in various things. So it's very, very hard to get a primary care appointment in the US. At least pre-COVID, it was much easier to get a specialist appointment, although now it takes a lot more time too. So we have a sort of inverted curve, which is inverted triangle, which is we don't do very much on the primary care end because we don't have the resources. We do much more on the intensive end. The typical Asian healthcare system is sort of better in the sense that like it's got a tertiary component, which is composed of like really good big hospitals and so on. You look across most Asian countries that I know of, and that's sort of there. And then it has a broader base of routine care. Where it's lacking really is in the wellness and prevention end and the primary care end. So you still have situations where people, I came here from Korea, and Korea, vast parts of China and like Japan and so on, when you go to the doctor for primary care, the appointment typically lasts 3 minutes. And you're like, okay. And and the records that the primary care doctor keeps are not integrated with any other records, and they're not taking account of what was going on in the hospital. And in India, the visits last 3 minutes and you walk out with 2.8 medications. And in parts of China, I believe that's still the case. I'm not sure how big a deal that is in the cities, in the big cities, but that's still a big deal in parts of China. And so you look at it and you're like, yeah, in principle, there's a base of primary care here, but in practice, like the thing is just all screwed up. And so that's the second lesson is we're going to have to fix this. We're going to have primary healthcare systems that work well. We're going to have, the US is going to have to continue to do major changes in healthcare. This is going to be on the financing end, as well as on the delivery end, and the organizational end, on the medical technology end, on all sorts of things. You're going to have to build something that works. And there are some models that work pretty well. Some of the Scandinavian models work pretty well. There are sort of scattered examples around the globe of sort of integrated care that work well, but it's not something that's very common. It's very hard to look and say, I want a healthcare system like this country, whatever country, this country, because this country tends to have certain problems associated with it. So that was the sort of national strategy. The third one is a local strategy. And what I want to point out here is that in an era of pandemic disease, sickness anywhere can lead to sickness everywhere. So if you look at the set of pandemics that we've had in the past, few centuries, and among the risk factors for them are smoking, obesity, unsafe sex, sharing needles, variety of stuff like that. That happens everywhere around the globe, which means that everywhere around the globe is at risk. Anywhere where urban people have gathered, what you see are huge disparities in health. So on the left, I'm showing you New York City. For those of you who've been to New York City, life expectancy by area in the city. You can go from the Upper East Side of New York in Manhattan right here, about 10 miles by subway, roughly, take you maybe, I don't know, 10, 20 minutes. And in that stretch of time, you'd lose 10 years of life expectancy. So maybe you lose a year of life expectancy every minute you're on the subway. Now you think Americans are all stupid, and what do Americans know? This is London. And London, you of course don't go, well, you sometimes go by subway, but you could go by bus too, and you'd see the same thing. You turn the corner and you've lost a bunch of life expectancy. What are people dying of? They're dying of the same things, just more frequently. So if you look at Brownsville here, which is the sort of lowest life expectancy area of New York, and compare it to the Upper East Side, what do people die of on the Upper East Side? Heart disease. What do they die of in Brownsville? Heart disease. They just die more frequently of it. Oh, and they die of cancer on the Upper East Side, and they die of cancer in Brownsville, and they just die more frequently of it. So it's the same sort of thing. But obviously it's different. And this sort of comes back to the point, which is you're not, someone who lives on the Upper East Side of New York is actually quite exposed to someone who lives in Brownsville. They're not going to run into them every day, but the person from Brownsville is going to run into somebody who takes the subway with somebody. And the question is like, how many points are there? Like how many people are there between Brownsville and the Upper East Side by the time you've dealt with all the Starbucks and all the subways and so on? The answer is probably 3 or 4 people. So all it takes is a small passing of the virus from one to another to another. And then no matter how good your manners are in the Upper East Side, you will be exposed to the disease, to whatever disease that you're thinking about. It's obviously less the case if it's sexually transmitted than if it's virally transmitted, but still you sort of have the same sort of situation. So if you're on the Upper East Side, even if you don't care a whit about people in Brownsville, you'd better worry, because those people in Brownsville are the ones, even if you care only about your own health, you better worry because something can spread from one to the other easily. And the same thing with airplane travel, and people in New York are exposed to what's happening to people in Wuhan, China, with just a couple of airplane flights away. So every city is going to have to worry about the health of the lowest income people. And you can see here almost all, this is not just a story about rich cities. In Manila, there are areas where um, virus spread a lot. In Singapore, which generally had a very good record during COVID, when COVID sort of came in and took root, it was in the low-income migrant worker housing areas. So that's true across the globe. One of the interesting things about risk factors, so how do you get people, for example, to stop smoking and not drink as much and so on? On the one hand, it's very hard because those are very deeply ingrained behaviors. On the other hand, there's a fact about the US, which I'd be curious to know if it's true internationally, but I'll just sort of give it to you here, which is that in cities where there are more college graduates, people live longer. And in fact, what's interesting about that is that people at every level of education live longer. So that is to say, New York has a higher share of college graduates than many of those places I showed you in the interior. Let's take places in Oklahoma or Texas. It has a higher share of college graduates than most of them. People in New York live longer. In fact, people with just a high school education, no college degree, live longer in New York than they do in Oklahoma. And at least a good share of the reason why is because people in New York do not smoke. So the person with a high school degree does not smoke in New York. Partly that's because of taxes. So New York has much higher cigarette taxes than people in Oklahoma do, but that's actually it's true even controlling for cigarette taxes. What seems to be the case is if you ask people in New York and people in Oklahoma, how bad is smoking for you? A person with just a high school degree in New York says smoking is worse for you than a person with the same education in Oklahoma. So it seems to be an internalized belief about the way that one should behave. And so one of the things that I think about in terms of preventing disease at the local level is a highly educated population and a population that's then mixed across education so that people are exposed to lots of folks so that you see if smoking is bad, you see lots of people not smoking as opposed to lots of people smoking and so on. So the education component is really important here. Okay, so that's enough on pandemic disease. What I want to say is that even independent of pandemic disease, there are other threats to cities and that are really important. And I want to think of them a little bit like COVID, which is as structural problems that mean that it's really difficult for people to think about living in cities. Okay, so I've shown you here a map of house prices. So red is higher house prices, blue is lower house prices. Okay, so how many of you have been to the States? Okay, awesome. Now, so here's what I want you to do. Think about the place that you have been to most in the States. Okay, and is it red or blue? Okay, so notice by area, what is it, 90% of this map is blue? Okay, so you're going to vote. You're going to vote for, is the area that you've been to most blue or red? Okay, so here are the rules of voting. The rules of voting in China are, number one, vote for only one thing. Number two, vote for at least one thing. Okay, so that means you got to vote, and you got to vote for only one. So how many of you say blue? How many of you say red? Okay, so the vast bulk of people, those who followed my instructions, voted red. So those are the red areas are the areas, the New Yorks and Los Angeleses and Chicagos and Bostons and so on. And those are the areas with super high house prices. And the thing about it is that those used to be the engines of opportunity in the US. So there were long sort of stories about, people immigrants to the country would settle in New York, and that happened a while ago. And then people would move west. And so there would be immigrants who would settle in Chicago. And then people would move west. And so vast parts of people moved to California in order to get, an opportunity. And those are very high wage areas. And they're like really desirable areas and so on. And they're now virtually completely unaffordable for most people who are not extremely wealthy. And that's why I told you that like people in San Francisco don't actually, unless you're super high income, don't actually live in San Francisco because San Francisco is too unaffordable. What this reflects is most areas in the US have not built housing. So most of the red areas have not built a lot of housing. So when there's a lot of demand and you don't build housing, then prices go up. right? Whereas the areas in blue are either areas where people don't want to live, or some of them are urban areas. They'll just create a lot of housing. So Las Vegas is in there, and Phoenix, Arizona, and a bunch of places in Texas, and they'll just build out forever. They'll build into the desert and stuff like that. The implication of this is that, if you will, the insiders win over the outsiders. That is, people who are in the cities don't like building because they like what they have, and they don't mind that their house price is several $1,000,000. And then the people who would want to move to the city can't. And so upward mobility is thwarted because a lot of upward mobility happens by being around people who are in very productive occupations, and sort of success is thwarted. So, and you sort of come back to San Francisco because the sort of paragon of inability to build is California. And the, if you will, the poster child of inability to build in California is San Francisco. And so you create this situation where, the haves get to have, multi-million-dollar houses, and the have-nots don't get to have it. And then something comes and it means that you don't have to come in. And then all of a sudden, the city has gone south. And so this is sort of, if you will, the failure to allow for the normal sort of mobility is a real problem. And that can put a city on the edge, because you're fine as long as everyone wants to be there. So if people want to be there, then you can have the city, and, the insiders get their fancy housing, and everyone else will commute an hour and a half. But the minute people don't need to be there, you're now in a very difficult situation where you're sort of teetering on the edge. San Francisco has a ton of natural amenities. It's got this beautiful location. It's got great weather. It's got, a symphony and lots of artistic things and cultural activities and so on. So it's not going to die away the way that some things have. But on the other hand, you could imagine it being permanently a sort of less grandiose version of what it was. And that's really the question for a lot of cities, which is, do I want to be a kind of vibrant city that's a growing, sort of desirable place to be, in which case I've got to accept change, particularly building? Or do I want to be a stagnant city, in which case I then wind up with kind of, whatever it is that a stagnant city is, which can be fine or it can be terrible. So successful cities, at least in the States and in a lot of other places, are becoming permanently unaffordable. And that's really a big problem. And it's also a big problem because it creates, not that, but because our cities at least have created a lot of social conflict. The biggest social conflict in the US, I don't know, the biggest, in my mind, perhaps the biggest social conflict in the US, is over policing and incarceration. The US has amongst the highest incarceration rates in the known universe, and probably among the highest incarceration rates in the unknown universe too, but we don't really know that as well. So we have an extremely high share of the population in jail and prison or on parole, and it is disproportionate among minority populations. Okay. And so this creates then a situation where people don't feel like they belong in the city. So now come to a typical city where, the prices are super high. You don't feel like you can get ahead if you're not already wealthy. And if you're at all a minority, member of a minority group, you feel like you're discriminated against. And that's the way that a lot of cities in the US has become. And it sort of can really show up in resilience. So I showed you a graph of New York. New York's, sort of population had been going up. And then there was this sort of dip in the 1970s. What happened was the sort of bad times happened, right? So crime went up, and there wasn't a great response to it by the public sector. And house prices were kind of high, and like they weren't building places for people to live. And because of all that, people got quite afraid and so on. And then people left the city. And of course, when rich people leave the city, the tax base falls. And so when the tax base falls, then the city government goes, gets in trouble. And so, New York needed a bailout. And this was the presidential administration of President Ford to city drop dead. New York recovered because it has a ton of natural amenities, because people decided they did want to move back into New York, because government policy improved so that it did better. There are cities in the US that did not recover. So the city of Cleveland, anyone been to Cleveland? Its population today is 1/3 of its peak, probably 50 years ago. Anyone been to Detroit? Yeah, its population today is probably a fifth or a sixth of what it was at its peak. So those cities are still there, but they're just a shell of their former selves. So this brings me to the end. So I'll talk a little bit here, and then I will end it, which is how resilient is Hong Kong. So as I look across the the lessons from the US and as I say, around the world, how resilient is Hong Kong? I will be the most speculative here. I understand that I'm in danger of offending people, so I will try to be a little bit careful with what I say, but then again, the worst you can do is throw me out. So, so why should I worry about that? So the first thing to say is that there are a bunch of negative headlines. So that's, I suspect that's true always, but these are just headlines from the past month. So long, Hong Kong, Asia's business hub, loses its luster. In charts, Hong Kong's economy is struggling to recover lost ground. How is it that I think about Hong Kong in relation to the issues that I was talking about here? Well, first thing is actually Hong Kong did very poorly during COVID, at least very poorly with respect to other Asian countries. If I put the US here, the US would be the high up on the list in terms of deaths per million population or here. Nonetheless, Hong Kong did very poorly. I know Sophia will have things to say about that, and she was teaching me a little bit about it before. But that really truly is a failure of, I don't know, policy in the broad sense. I'm not saying specific policy, but policy in the broad sense, which as I understand it was, we're not really going to kind of force vaccination of people. We're not going to do whatever it takes to vaccinate people, whereas most other countries both had a commitment to zero COVID and also a lot more on the vaccination end. So Hong Kong did very poorly here. So strike one is kind of, is Hong Kong, if that's going to happen, and I'm worried about pandemic disease, is that, should I think about Hong Kong as being a country that's going to permanently do badly or not? I don't know that that by itself is decisive. A lot of countries in East Asia did very poorly with SARS. So SARS was, most deadly in East Asia, and COVID was probably least deadly in East Asia. And then they learned and they got much better the next time. And so I think the question is both, does one do well, and then does one learn to do better over time? Housing is still extremely expensive in Hong Kong. I suppose I probably don't need to say that in this room, but it is, amongst comparable sorts of cities. If you want to move to San Francisco, I told you house prices are high in San Francisco, but they're far, far less as a share of income than they are in Hong Kong. So all of you should go buy up housing in San Francisco. So that housing issue is again a problem, because if you want to think about what is the what are sort of lower income people who are going to, who want to be kind of upstarts going to do, and are they going to move to Hong Kong? And the answer is, I'm not totally sure about that. People in Hong Kong are at work, so it doesn't have the, if you will, the San Francisco issue, which is nobody is coming into vast areas of the city, and so vast areas of the city are sort of being depopulated. If you look among like a lot of the big cities in the US, the country where the fewest people are sort of at work is the US. Back at work, this was the sort of question in the survey. Back at work is a little bit strange. My understanding is that there was never a not at work in Hong Kong, whereas there certainly was like a not at work in the US. So this is like an Americanized version of the questionnaire that may or may not make sense in all the different areas. As I look at Hong Kong, I'm actually a little bit worried, not like panicked, but I'm worried that Hong Kong didn't handle disease super well. It's still extremely expensive, and there are alternatives. And the question, like in the US, you can live in San Francisco or you can live in Las Vegas. It's probably not as easy to live in Singapore as to live in Hong Kong. But on the other hand, it's not impossible to think about living somewhere else either. So if I'm thinking about like, is Hong Kong going to be like one of the existentially great cities of the world? Or will it be like a city? It will always be a city. What you've got is what the world has got here is so wonderful. But whether it is like one of the cities sort of makes me wonder how well it can deal with a lot of these challenges. Hong Kong does not have a crime problem as best I can tell, so it doesn't have that sort of issue. But it has a lot of the other issues. Okay, so I'm just going to close with a couple of conclusions. So there is a long-running tension between the benefits and costs of urban life. For a long time, the benefits were winning out. Disease had been conquered and people could move to cities and housing was relatively cheap and you could get a job and do well and move up and so on and so on. And that was true in the US. I think that describes a fair amount of Hong Kong over time. So it's sort of like that was the common feature across a lot of cities. The costs are rising in several ways. The benefits are still very, very high, but the costs are rising. And so that's going to put a lot of of tension here. The strongest cities of the future will address these. And we know there are ways of addressing it. We've seen cities come back, London was having a hard time and it came back, and New York was having a hard time and it came back, and stuff like that. But on the other hand, the weakest cities will decline. And if you go on too long, then there's really kind of, Detroit has a lot of natural resources, but that didn't stop its population by falling from 75% and so on. So it's a really big issue. Cities are hopefully here to stay, but any individual city is not. And certainly in its sort of current position, any individual city is not. And so that's what, as I think about sort of the future of urban life, what I think about is sort of partly, if you will, a great sense technocratic, which is how well can we deal with these really fundamental structural problems? And the parts of the world, the parts of the urban world that do so best are the ones that are poised to do best in the future. So let me stop here. Thank you so much for indulging me on this. And I'm just delighted to be able to take part.
Thank you so much. Thank you so much, Professor Cutler. Please take a seat. Okay, to commemorate today's event, we would like to invite everyone to take a group photo now. Please remain at your seat while a photographer take a photo.
So here, one, two, three. One more. One, two, three. One more here.
Let's give a thumbs up. Let's give a thumbs up.
One, two, three. One more. One, two, three. Thank you.
Thank you so much. Thank you, everyone. Shall we take a 15 minutes break, and we will be back at around 4:10. 4:10. Please enjoy the refreshment at the back of the room, and we'll return very soon for the panel discussion. Thank you.
确认一下，绿色应该是好的。
table to the side, okay.
Yeah, I'm fine.
Just like on a point at them.
No, I mean, this,
It's kind of a.
but so I didn't, there's some good information. If I'm living in this part of the world, I'm living in the world. I also, you guys should be in.
Not fair what our population is based on different days, right?
Yeah, it's very songs that I know. It sounds very good. When I look down the list, the countries, I'm not sure if everyone else is so good.
Credit cases, right?
And I might be wrong. I don't care.
But this is this sounds like a defending. Because we have also prosecuted. Yeah, you know, where to buy.
That was a success.
Okay, good.
Yes, ladies and gentlemen, we hope you enjoyed the refreshment and the conversation. We will continue the second part in 2 minutes. In 2 minutes, please return to your seat and we'll start the panel discussion very soon. Thank you.
Talking about we are probably a victim of our own success. I think many countries, I mean, even during the pandemic, were not able to get enough tests. So don't less, no counts.
Yeah, no, it's great. Like, that was our first comes.
Yeah,
And we want to see what's there.
yeah, that's right. And you can't count the death rates into COVID.
At some point, it doesn't make sense.
It's okay. Some minutes over there.
Yes.
This one seems like a good full action.
Ladies and gentlemen, welcome back. So our next section for today's conference would be the panel discussion. We're privileged to have a panel of leading figures in different fields joining us this section. Today's discussion topic is Building Cities' Future, Environment, Health, and Social Services. Our moderator for the panel is Professor John Clother, Assistant Professor in Economics, HAU, and our panelists include Professor David Cutler, Professor Sophia Chan, GBS JP, Senior Advisor, President Office, Professor and Director, HAU Primary Health Care Academy, HAU, Mr. Kam Sing Wong, GPSJP, former Secretary for the Environment, HKSAR Government, Distinguished Fellow Department of Architecture at the University of Hong Kong. And also Professor Eric Schudenfrei, Associate Professor, Department of Architecture, HKU, and also Mr. M.K. Leung, Director of Sustainable Design, Ronald Liu and Partners. Please welcome our speaker to the stage, please. Hey, thank you so much, Professor Kloffler. The stage is yours.
All right. Does this work? Good. Thank you. So thank you all for coming. Very excited to follow up on Professor Cutler's discussion with our distinguished panelists, some of whom are colleagues, some of whom are working in the private sector, like many of you. We brought together these folks for a reason that I think is not spelled out fully in Professor Cutler's book, but which is very important. It's when we talk about the health of cities, and when we talk about public health, those things are tied in very closely with work that's done across a wide swath of the government in a city and also throughout the public sector. So we have representation, obviously, from the government with Professor Chen, with KS. Eric here is not only an academic, but also a practicing architect, and MK as well. So I'm really excited to hear from all of them. We're going to start with Professor Chen. Take it away.
Okay, thank you. First of all, thank you very much for this invitation. Obviously, you know, COVID-19 is very dear to my heart and everybody's heart here. And thank you, David, for sharing with us such an insightful analysis, you know, of a topic that is a little bit outside health, but it is also related to health. So if I'm going to start first, you know, I have like 3 points to make. First of all, if we look at COVID-19, if we recall, it is very important for us to revisit some of the prevention and control measures that we have been embarking on. And with that revisiting, then we'll be able to have some lessons learned. And that's my second point. And third, of course, is what's next. So what are we going to do next? That's the most important. As David have earlier talked about the fragility, you know, of the city. So how are we going to improve the fragility? So I think that's sort of looking forward. So if we're going to look at the prevention and control, I want to put in, you know, two very important concepts, which we always talk about, you know, in health. First is preparedness. And second is response. So during a pandemic, infectious disease control, there is always a preparedness part. That is, we prepare for it. And then there is always another response part, because often people are talking about, you know, why don't you do it earlier? Or, you know, why is this late? But there is always a response part of it. So when we don't know the situation, then we are not able to respond, especially when this is something that is, you know, so new. So, you know, in the prevention and control, we always talk about TTQI. I don't know whether you know about it. You know, T is testing. These are the 4 most important concepts. T is testing. Another T is tracking, and also well, testing, of course, includes surveillance. Another T is tracking and also tracing, so contact tracing. And Q is quarantine, and I is isolation. So there is a difference between quarantine and isolation, although I think in the media it used interchangeably. Quarantine means it is not a case, but you have a high risk to become a case. So that's why you need to be quarantined. For isolation, you are already a COVID case. We want to isolate you, you know, from the rest of the community. So we have 5 or 6 waves in Hong Kong. And before the 5th wave, actually everybody is isolated in the hospital. It's only in the 5th wave that some of the cases are actually in home isolation. So with, you know, this kind of prevention and control measures, the objective, of course, is 2. First is preventing importation from outside. So that's why we have very stringent travel measures. And second is preventing spread within the community. So when a virus came into Hong Kong, then we would have to contain its spread. So these are these two core principles that we are holding. And of course, that lead us into, analyzing, what are some of the things that have posed challenges and, how do we learn from it? So first of all is legislation. So we have, throughout the few years, actually have enacted 10 prevention and control new legislation, mask wearing, social distancing, and so on and so forth. So this is very challenging in terms of getting this enforced. You need a lot of manpower. You need a lot of new measures. Secondly, because COVID has been new in the beginning, so a lot of study have to be in place, research side by side with the measures. So, understanding the virus and how to contain it, and also initially, how to test it and how to later develop not only PCR test, but RAT test. Surveillance is also very, very important, that we actually know where we are, and then, we can, capture the latest situation and then, go for it. Of course, testing and also vaccination is something that, if you remember, we have tons of centers, testing centers and vaccination centers that we have built in the community to contain the spread and also to build capacity among the healthcare workers on this. But one of the major challenge that I think that we must learn from it is risk communication. So while there are a lot of risk, we identify risk, we stratify the risk, we contain the risk, but how do we communicate the risk to the rest of the people in the community? Because it is an sort of all over Hong Kong situation, and not only Hong Kong, but also, the rest of the world. So risk communication is something that I felt that we can improve. And of course, if we talk about vaccine, another challenge that we have faced is the vaccination hesitancy. If you remember, before the fifth wave, the reason why we have all the deaths, that happened, and all the morbidity happened in the fifth wave in particular, was because of a very low vaccination rate among the elderly people. And why? Well, a lot of vaccine hesitancy, a lot of mistrust of the government, and also the younger people do not agree the older people getting vaccination. And in particular, also is the elderly home, which is also another like a bomb, because the elderly home traditionally is not a healthcare institution. It is more viewed as a social welfare institution in Hong Kong. So we need more professionals, healthcare professionals in the elderly centers. And that's something that I felt that we need to do better. And another lessons learned is, of course, the cross-sector collaboration and cooperation, because in the government, not only the Health Bureau or the Food and Health Bureau at the time is working, but there are many, many bureaus that are actually working together to make this whole city initiative run, and also in terms of prevention and control. So finally, what's next? So what's next? I think, first of all, I think one way is to align with the existing policy. That is, whatever policy the government is pushing out. So when we think about, building cities' future, when we think about decreasing the fragility and increasing the resilience, then we can sort of align to those policy. One is primary healthcare. So the government is embarking on a primary healthcare new journey. So if we think about it, at the time of COVID, we don't have all these district health centers. Now we have a territory-wide district health center in each of the 18 districts in Hong Kong. So if you imagine, if we have COVID now, what is the role of these district health centers? What else, can they do in addition to vaccination? Education that David have talked about. you know, and many others, because there is a localized and also district based. So I think there is a lot of role for you know, district health centers. Second is a northern metropolis. So the government is this is going to be a policy. The government is going to build the northern metropolis that have 2.5 million people living there. So so this is going to be like a new city that the government is, you know, going to build. So in terms of building cities futures, you know, with this panel discussion title, you know, the environment, the health, the social services, and all the rest of it, are we going to be more prepared, you know, for it? And finally, of course, if we go back to preparedness and response, so how can we reduce the fragility through better preparedness and better response, you know, in terms of all the lessons learned, you know, throughout the past few years. Thank you.
All right, so we will take about 5 to 7 minutes for audience questions. It's an open floor for who would like to ask a question of Professor Chen or another panelist related to the same topics.
Would it be better that we can all present?
Or we could just go, yeah, we could,
Yeah.
do you want to go linearly?
Sure.
Okay. We'll have Eric go then.
Thank you. It's a real pleasure to be here today. And I did prepare, unfortunately, some slides. So I'll just go through some of the ideas about changes we could make from our city point of view. So I'm looking at it from the perspective of architecture. And one of the reasons why I think architecture is such an important component, and the city itself is a component to study, goes back to 1849 and John Snow, who's regarded sometimes as the world's first epidemiologist. And what he was looking at was disease in a city, and he was mapping it towards who had different death rates according to who got water from what part of the Thames. Those who are upstream from the Thames and got their water, they survive very well. Those who got the downstream water after it had gotten a lot of pollution from the city, they didn't survive very well. And he wrote a whole book on it and noted how devastating those who got the downstream water were hit really hard. And of course, no one in London listened at the time. And that was 1849. So the next 5 years, he kept at it. He didn't stop. And in 1854, he decided to look at the next epidemic that hit London. And he tried to get the government's attention and the citizens' attention. And so he drew a map. And the map that you can see here is there's a red circle behind one of the speakers. And the red circle shows a pump handle where people are getting the water from. And every tick mark on this map that's going down along the blocks is one death. And he just drew a simple map where he put in the different pumps, and you can see the different pumps are in blue. I added the blue and red just for clarity to his original map from 1854. And wherever there's a tick mark, there's a death. And he convinced the local government official to take off the pump handle, therefore not allowing anyone to get water from that pump after he took off the handle. And lo and behold, he took off the handle and people stopped dying. And only then did he manage to convince the city, for a very brief time, for a year or two, that water was important and sewage was important for the city. After a few years, everyone in London forgot and life went on as normal. And we had the same problems in London for decades later. And I'll come back to that. With COVID, we learned a lot of lessons. We learned some of those lessons pretty speedily. We learned when something happened in, say, 24th of January, and by 22nd of April, there was already a paper by one of our Hong Kong U professors, Hugo Lee. And what's notable about this paper is it points out that those in the slipstream of the air conditioning all got COVID. Not all, but many of the people in the slipstream of the air conditioning. But what's remarkable is that those in the restaurant who are not in the slipstream of the airflow of that AC, where one person had COVID and gave it to many others, all the rest of the people in the restaurant were fine. Even the people serving those tables were completely fine. So if you are unlucky enough to be in the slipstream of that AC, you were probably unlucky enough to get COVID. And in another study, also involving Hugo Lee and others at Hong Kong U, we have 616 days between the event and the study, and it was on a bus. And the bus had a unique feature, which buses have, which is air coming in, and then it travels down the whole bus, and air has to leave. You can't just have air in, it has to have air out. So the air in at this bus was at the back, and the air out was at the front. And almost all the people who got COVID on that bus were all, again, in the same slipstream of air. As it went through the bus, it had to go in one direction. If you look on the other side of the bus, where they're not in the slipstream, only one person got COVID. So air seems to be rather important with COVID. And if we look at Hong Kong, a lot of our spaces are really intricately connected together. And these are photos taken during the peak of COVID in Hong Kong. And you can see in our buildings, I come from architecture, so I look at buildings. We can see that a lot of people have their windows open, therefore potentially connecting those apartments inadvertently together. That might be kind of problematic. And that's what I'm basically researching and looking into. And we can see these are actually rather average COVID numbers for these particular buildings. These are all buildings that had what's known as a RTD, or testing done throughout the whole building. So we know that it's 11% for this building, 12% for that one, and 15%. These are by no means the worst buildings in Hong Kong. These are just to show some of the ideas. And I have a theory, and the theory is totally unproven. So this is where the research goes. This is why it takes effort. This is why it takes years. But the theory is really simple. I use a sensor throughout COVID, and the sensor has a CO2. And I notice when I sleep with the sensor, the CO2 from my room goes all the way up to 3,500 parts per million. And let's say 400 is normal. 3,500 is a lot of CO2. I open the window in the morning, and actually when I open that window, I always wonder, where does my air go? Does it go out to nature, or does it go to you? Am I passing my air, likely, in one go? And when I measure it, I notice all 3,500 goes back down to 400 in about 3 to 5 minutes, meaning that's all that air. Imagine that's like a dose of, well, we don't call it medicine. Imagine that's a dose of virus that I'm giving to my neighbors. Imagine I'm sick. I open that window, 3,500 parts per million of air in one short dosage goes somewhere. Where does it go? So a lot of these Hong Kong buildings have what's known as a reentrance space, a space or gap between two buildings. And in SARS, that caused a problem. And that was also a problem with SARS. But no one really looked at that reentrance space too closely. There are a few papers and a few academics who have looked at it. But this is what I'm really investigating. And if we look at some of these Hong Kong buildings and we zoom in to them, what we notice is that in many Hong Kong buildings, there's a bathroom, which we know from COVID is quite not a good space for COVID. And that air that has a vent that pushes the air from your apartment, when you turn on the vent, the air goes somewhere. It actually is connected to a kitchen right next door for all your neighbors. And if we keep looking at our building designs, the unfortunate architects who designed them, you can see why I'm so interested in this. You can see that, again, these are two bathrooms that go to a reentrance space, that go directly to kitchens. And all these designs actually have two bathrooms again, reentrance space. So if there's a positive air pressure, air that's pushing in one direction, that air has nowhere to go but in. If you're luckily on the downwind side, that air will get sucked out. It'll go out to nature. But if you're on the upwind side, it's completely different. So we've been looking at each building, and we have the RTD data per building. So we know how many people for about 500 or so buildings got infected per building type. And a building type is a design, basically like a design characteristic, design feature. And I'm really interested in the black air. Let's pretend that's good, fresh air. The red air goes through someone's apartment and goes out the window. And then the orange arrows are showing that it goes back in. So it goes outside fresh air, inside, say they have COVID, back out and back into someone's apartment. And that's what we're really interested in. The second part that we're really interested in is, what do users do? If we opened a window right now and opened a door, the airflow of this room would completely change. Absolutely change, 100% change. If we open that window versus that window, the airflow will 100% change. We can't just use models to predict. We actually need to know who's opening what windows, how frequently, for what temperatures, for what seasons. And we've been tracking that and putting it all into Excel, and then building three-dimensional models that are driven off the Excel in real time. So if someone opens a window, we know that window is open and the model updates, the physical model, and we can analyze it in real time. And so we're using a lot of sensors to better understand users' habits. And say some users never open a window, that's fine. Then we at least know and our data is more accurate. Or if for a particular building, the users of a certain age all open their windows, then we know as well. And we're studying how that really impacts COVID in real time, for not COVID for real time, but the airflow in real time to better understand. And as was already said during Sophia's talk, we had a problem in COVID. We didn't know how COVID moves from room to room. We actually don't even know how the flu moves from room to room. One of my favorite slides is the influenza on one of your slides. It keeps coming back again and again and again. And one of the bubbles was enormous. It was like 25 to 50 million deaths from flu. I hope everyone had their flu shot, because we still don't know how flu moves through the air. If someone has a flu, we don't know who will get it. And because we don't trace and track flu, we actually don't know who's giving it to whom. So a lot of the studies are really about using sensors that we developed. So we've developed a very small sensor, a very inexpensive sensor that can measure the CO2 value and where people are with privacy preserved. So we're using your Bluetooth, which changes the identifier every 10 minutes. So we don't know who you are. We just know that people are there or not and where you are, but we don't know who you are. And then we're tracking, these are pressure sensors. So we're using pressure differential so we can figure out where for one room the air is moving. And hopefully this will play. And if not, I'll just keep moving. But is there a play button? Or do I push the play button? Okay, I push the play button. So these are people, and this is people in a space in CO2. So we have, for this space, we have CO2 monitors that we develop for every 4 meters. And then actually the thing that's tracking the people is just a smart light bulb. And the only difference between the smart light bulb tracking the people and the smart light bulbs of this room are that we updated the firmware, like the software inside the light bulb. So it's a commercially available light bulb sold globally at the tens of millions scale. And the only thing we did is update the firmware inside over the air. So we can do an over the air update. And so with this, we added the wind. So this is the air, the wind. And you can see in here that if the person who had COVID was sitting here, that would spread it to almost everyone. But if the person with COVID or flu was sitting here, that just pushes the air back outside. So that would be completely fine. And then we can combine the two. So we can actually see where are the people, where's the CO2 accumulating. CO2 is just a proxy for people breathing and the air not going back outside. It's just staying in. So we can also see the effect of like an open window. Eventually in the animation, there'll be an open window here. You can see it comes down. And we can see where the air came from and where the air is going. Right now in this room, I can't tell you where the air I'm breathing comes from. I can't tell you where the air you're breathing comes from. Is it coming from across this way or going exact opposite? We can't tell you. But if COVID happened in this room, this is the 3rd floor of the architecture building at Hong Kong U, we could tell you exactly where the air came from. We can tell you exactly who might be predicted to get COVID. We're also doing a lot of tests within our spaces. This is a neutral buoyancy balloon test. So we send a lot of balloons out into the space, and then we can see where they go. So we can actually understand through time the average airflows in the space more precisely. We attach our sensors to that as well. Because we can't send balloons, or we don't want to send balloons outside the building, we use neutral density bubbles. So it's basically a bubble that if you blow it, when you blow the bubble, it just sits in the space until it's blown by the wind. And we use computer vision and AI to track where it's going across buildings. And we actually discover that buildings are connected in ways that we never imagined, especially with the density of Hong Kong. So one building could potentially have an interrelationship with the flu or COVID to another building that we're discovering when we use the bubbles. And The two other tests that we're using is a water tank test, and that tells us the buoyancy about how the air flows up a building. And we also do a wind tunnel test, so we can think about how air moves between apartments and units as well. So with these tests, the idea is really simple from an architectural point of view. We cannot tear down our whole city and rebuild it from scratch. We just can't afford that from an environmental point of view, nor do we want to do that. But I see it as, these extra little winglets that we added to airlines. And when we did that, decades ago, we took an airplane, like a Boeing 707, an old airplane, and we added these little winglets. And just this little winglet that was added, that doesn't cost that much, saved 6.5% of the fuel every time that airplane is being flown. So the concept is actually adding sort of winglets to buildings, or changing the airflow in a very subtle way that brings the air away from the building so that we don't breathe each other's air, essentially, allowing for more sustainable buildings and not relying on mechanical ventilation. This building completely relies on mechanical ventilation. We can't open these windows. But for a more sustainable world, we want to be able to open the windows on a nice day like today and not have the AC of the room or the mechanical ventilation. So we want to be able to have a sustainable city, but we also want to have a safe city. So I'll just end it there, but with just one other word about the WHO. So in March of 2020, they said, fact, COVID is not airborne. And that fact check, COVID is not airborne. It even says COVID is confirmed as airborne, and it has an incorrect stamp on it to emphasize that COVID is not airborne. And then 400 days later, on May 4th, 2021, the WHO finally admits coronavirus is airborne. It's too late. And that is not WHO only. That's because they didn't have the data. They actually didn't know, just like we don't know for the flu, how the air is moving. If they knew how the air is moving, perhaps they would have known that COVID is airborne much earlier. It's still a slightly better track record than John Snow in 1854, which took 21 years to get us a sewer system that was operational in London. So we're still doing a bit better than John Snow's day, but just only slightly. Thank you.
Okay, my turn. Well, I'm also an architect, but I will be sharing you with well, what actually the practice are doing, and rather than the exciting bit, what well we have just heard, and probably bring you more back to the ground of what currently what we are having and what we may expect that well, if people continue this practice, okay, what probably may get us to, okay? And I don't have the, if you don't see, well, the slide, it is okay, because I don't have too much slides. Probably I will focus on three topics. First is about the standards. When we practitioners do buildings, what we are, well, based on. And these standards are well, upgrading, I would say in an average 2 to 5 years. So, but well, we can somehow follow this standard and project what we are getting next. And I will talk more about that. And secondly, is about the role of building code, what we may expect it from regulations. And thirdly is about some of the things we practitioners are trying to do, okay, in the near future. And just to get snapshots of the innovations. Well, these are some of the buildings our firm just completed. One is quite near here. The other one is across the harbor. And you will see that, well, these are first tier. And when we talk about these buildings from a perspective, what we are talking about today, green buildings, wellness, okay, these are some of the labels they get, and these two buildings actually get the highest ratings from all these certifications. But next time when you well discuss about these certifications, you should know that well, they are different by nature. For Beam Plus, LEED, and probably the 3-star system in China or other systems you may have heard of, they are somehow called holistic, comprehensive green building systems, which they look at different objectives. And for wellness, for well certifications, it is a bit different. It focuses on health and healthy buildings. So I would probably do a bit more on well certifications, but you may know that for well, it is particularly interesting because it is a balanced and holistic in a way. It does not just look at design, but also look at the operations as well, which makes it quite different understanding. And on this aspects, on 3 areas which we may be very important concerned about. First is about the amount of air. Well, we have just heard about, which is so important. Well, what well systems is advocating? Well, it looks at quite a large number of external air, okay, coming in, depending on the occupancy. And the standard, the industry standard is quite, well, we in Hong Kong, we talk about is ash rate. And in most of these buildings, you look at it is occupancy determined, and you may have more fresh air when you have more occupants. So this is somehow energy efficient as well. And when we look at the outside air in indoor air, it is important to note that sometimes outside air can be even better than indoor air, but really depends on context. So we typically employed a lot of, well, high-grade filter in a way to make sure the air we take in is good. If the street air is not good, then we have to go higher up. The good thing is Hong Kong is a high-rise city, so does help in a way. Well, about recirculating air, we do have a lot of measures. Well, for the mechanical systems, somehow, especially when the outdoor air is not too reliable. So if you may have heard about carbon filter or even UVC filtering, which we kill germs and by the circulation systems, but these are quite an expensive, especially the UVC circulation systems. This is something, well, this is a state-of-the-art practice for us. And of course, material, we are concerned about the material we use, make sure that it does not emit TOC, VOC, or some other harmful materials. For the building code, one major question people ask when we compare this kind of standards with our regulations are we controlling indoor air quality for our building regulations? At the moment for Hong Kong, from building design point of view, no. We did talk about that, well, among the stakeholders, but the common consensus is, well, we are not up to that yet. So there will be, for air quality, for indoor air quality in particular, it is better to deal with by other means, which in the building standards I've mentioned, the green buildings as well, we have that control. And in Hong Kong, for the building code, we somehow encourage you to adopt high standard for these building certifications. You will get gross floor area concessions. You have free, in a way, free GFA. You can build more actually for your site if you can achieve a high rating for the green building certifications. In Hong Kong, almost everybody goes for it because it means a lot of money. So in building codes, well, I'm sorry about this slides. It doesn't look that way, but anyway, what I'm trying to say is our building code is somehow in directions trying to go for performance-based rather than prescriptive, meaning, well, we are having a certain performance standard that buildings can achieve and give flexibility to design to achieve that objectives. So here for lighting and ventilations, we have a performance-based approach. And now for others aspects in building planning regulations, we are looking at that as well. Well, one thing, well, when we look at the building and planning regulations standards, well, this is a slide which highlights what the prescriptive requirements now we are looking at. Is we do have a minimum window area and open area requirements, but for the practice, actually, it range quite a bit from the lower end to the, upper end. So there are rooms that we can consider, well, upgrading this design or this design standard or regulation standard. But as you may know, building regulations is unfortunately somehow is a consensus base, and you have to get all your stakeholders to agree on something. And I would say well, if we hope for regulations, tightening regulations, well, we should go for it, but it would take time. So rather, we should go for certifications which an incentive which can promote good design standard. And well, what next? Probably our practitioners are trying to achieve more. And well, this is again an incentive which the buildings department roll out. If you want to get more GFA for your project, you need to comply with a better urban ventilations. In fact, this is related to KS. He is the the brains behind this research, and we propose that the urban environment needs to be permeable in a way, and also we need to include green coverage to a certain extent that can achieve a sustainable built environment. But to make sure that this is achieved, it takes a lot of time and somehow the practitioners find it quite troublesome and resource demanding to achieve some of these criteria. So we are looking at devising some tools to look at it, and this is a matter evolving. And also, when we design buildings, we also look at how our buildings may design with a different mindset. For example, do we need single conditions for our interior, or can we allow for certain areas which, like here, the green denotes something which is natural ventilated, and the different shades of blue denote that some area which has different conditions, because as human being, we know that, we have different preference. And if we have the opportunity to open our windows here, like a picture showing the pressure difference on our facade, which means if we open windows, there are good ventilations, then, we may create a different gradient of thermal comfort, which, we can, as individuals, if we have certain preference, we can go to where we belong and stay there and go with our personal preference. And some of the application these days suggest you and match your individual preference to certain space that you may like. And if it is designed as an activity-based kind of workplace. I mentioned about the greenery percentage the government tried to promote, and it is a good thing that those greenery must be in a common area. But we need some tool that well, in the common area, how you can get connected with those green, and that we are having some tools we know that well can measure where the space can have a better biophilic connections. Well, all these, well, I guess, is to help designer or an architect to design a space which at the start of the design, we know we are at the right options, rather than having the performance well optimized at a later stage, which is very costly. And I guess this is the current, well, I guess the efforts of the practitioners hoping to do a little better, be better for this objective. Thank you.
Good afternoon. I'm the last one. Thank you, Professor He, setting up this dialogue. We have the professor from Harvard. We have two ex-ministers. We have three architects. My background is also architect. I don't know why you grab so many architects here. Okay. But perhaps for a city, high-density cities like Hong Kong, architects about the built environment are important. And I chose to be the last one to speak because I know that Eric will cover his exciting research. He called me, when did you call me about your research? 2022 March 19. Okay, when I was the minister, one day he called me, hey, he discovered something. This is about COVID, right? I would like to get information. And MK talked about Hong Kong's regulation and planning, how to make our city healthier. And also in terms of design, green building certification, well, need BIM Plus that can also help to make buildings, in particular new buildings and some existing buildings operation greener and healthier. And today's topic is covering our future, our city, our built environment, and covering environment. That was my policy portfolio in the past decade, and health is under Sophia. Okay, so these are interrelated and important. So what I would like to supplement is that two things. One is what we may have learned from the pandemic crisis, right? Don't miss a crisis, right? It's not good, but we should learn from that. And John is interested in my task during the pandemic, right? That, as Sophia said, that different bureaus, the department had to support Sophia to fight the pandemic. At that time, when I was the environment minister, I looked after climate change, air quality, waste, and wastewater. So I would like to talk about wastewater that Eric briefly mentioned. For pandemic, like COVID-19, actually we can trace the spread through the wastewater, right? Do you guys know that? That was an interesting process. And the wastewater surveillance tracing have at least three benefits. I can call them 3E. One is that is a kind of early warning, as Sophia said, the earlier the better. For pandemic, okay, the disease would stay in one's body for a few days before he or she discover that he got it. But actually, in his or her daily discharge, if I test the sewage, I can test whether he got it or not a few days earlier than the guy. So that is the beauty of the sewage surveillance. That's number one. Second is that it's economical. We can take a sample from a building. A building can housing hundreds or even thousands of people. One test can trace or understand whether there's any single person got the disease in a building, or even for a district. We set up systems for 18 districts in Hong Kong, and there are sewage treatment plants. And for each one, we can know whether Sha Tin, Central, or other areas. That's really economical, right? Even though it's not cheap. Okay. So it's early warning, is also economical. And last is a kind of elastic system. It can zoom in or zoom out. We can cover the entire Hong Kong, understand which district or which areas are having the worst pandemic situation. Or we can zoom into a building, depending on the piping arrangement. We can understand which in the estate, so many towers, which towers got the worst cases. So that was the history. So Hong Kong probably was the best city in the world during that time that we built up a system to cover the entire Hong Kong. And more importantly, it's dovetailed with Sophia's policy. Okay, that means if we find that a tower, a district, or an estate with the signal, the red signal, then she can have the order to have compulsory testing or to fence off the area. I can share with you two examples. I think it's in which year? The first year that with the Chai Wan Chun. 2020, 2020, almost near the Christmas, not near the end Christmas. In our test, we found that 2 or 3 towers in Chai Wan Chun in Kowloon Bay, 3 towers for a few days with the red signal, right? We are not sure whether it's correct or not, right? This is the first ever on Earth with a constant red signals for 1 to 2 days, right? Then we make a decision the first time is to ask for compulsory testing for 2 towers of these 3. And magically, we found that a family with 3 to 4 persons that have been sick for sometimes, I think they are ethnic minorities, something like that, or grassroots people, that they stay at home without going to see the doctors and regret that out and find that is actually they got the pandemic, the COVID. And then after 2 to 3 days, we continue to monitor the same tower and find that the red signal came again. And the problem. And then we have compulsory testing again and find other families living in the same tower. So that was the beginning that we have confidence of this sewage surveillance. And then after the New Year and after the Chinese New Year, the pandemic broke out in Yaobade, in the older areas. That is more chaotic because in the older areas, the occupants, the sewage systems are very different, right? And this is the first time we overnight fence off the area and have compulsory testing. Okay, and actually they are involving different city blocks, and almost 99% that we got the patients hiding in those city blocks. Okay, and then we developed the whole system to that we can test and trace the spread of COVID-19 in Hong Kong. And after that, other cities, including Singapore, mainland cities, try to learn from Hong Kong. Okay, so that was history. But I think that we got the system in place. If it's in need, then we can reinstall the systems and to help Hong Kong to trace the spread of pandemics in the coming time. There's a story, okay. But looking ahead, I think that there are different parameters affecting our healthy cities. And over lunchtime, I talked with David about climate change. I think that's important impact to us. I think if we are staying in Hong Kong in this summer, right, we can feel the extremely hot days. It's long and hot summer. Since last year, this year, the extreme weathers are getting worsening in these days. David, you are lucky. You came to Hong Kong last week. It's still summer in Hong Kong. Yeah. So in order to make Hong Kong a healthier city, I think the climate actions, decarbonization, and climate adaptations are increasingly important. So for companies on ESG, I think that we should pay more attention to the climate-related issues. In view of time, I'm not going to go into details, but may I advertise my book? Okay. Okay, I wrote a book today, this year in the book fair. It's in Chinese, David, so it's not for you, okay? Okay, but it's about how Hong Kong, there are 40 stories about 50 people in Hong Kong, how we are having a kind of low carbon, healthier lifestyle and careers in the context of Hong Kong. We can make money, we can have a healthier and happier life, but at the same time, we can help Hong Kong and the world to reduce the carbon emissions. So thank you, Professor He, for setting up this event. It's a big topic, okay, not only the pandemic, but many other issues. But I think you set up the dialogue. It's meaningful that we are involving different peoples, at least architects, okay? Then we can full research and practice that. I said that it involves a kind of multidisciplinary approach that we have to work together. Then we can make Hong Kong as a city better and the greater city in the future. Thank you.
Okay, so thank you to all of our panelists. You might not see all of the connections yet, but I hope you've seen some of the connections between their work and the job of keeping Hong Kong healthy and a good place to live. Now I wanted to let Professor Cutler wrap up with some concluding remarks before we open the floor. Thanks.
So thank you. So I thought the 4 sets of comments were just terrific, and I learned a lot from them. And I wish I could read the book to learn even more. So you'll have to let me know when there's an English language version that I can do. Let me just make 2 comments based on what folks on the panel said, and John, based on where you started off. The first is you've put together an interesting title, which is Environment, Health, and Social Services. And I think what you meant by that, at least I will read into what I think you meant by that, which is that the 3 of those have to work together or you're not going to be successful. And I think that's exactly right. That is, we sort of heard about the environmental part, where if you don't have the environment right, it doesn't, right, then a small COVID outbreak somewhere turns into a huge COVID outbreak everywhere. And we heard about the health part, and that's, you know, if you don't have the policies right, or people are skeptical about the policies or anything like that, then you're not going to be able to contain disease or trace disease or prevent disease or treat disease or anything like that. We haven't spoken too much about the social services on the panel, but it's fairly similar, which is, you know, if you think about quarantining, right? You sort of mentioned the word quarantining and isolation. And I always tell my classes, you know, when I talk to my classes, I say, well, what does it mean to quarantine? They say, well, you know, what does it mean to quarantine? You say, well, you know, you got to stay in your dorm room, undergraduate students. Well, suppose I want to leave. Well, so literally it's sort of like, I almost have to have a Harvard University policeman outside your dorm room preventing you from leaving. And then if you're not going to leave, how am I going to get you food? And who are you going to get to see? And so you bring in the whole social services sector into that too. One of the things about this is that it involves so many parts of government that government has to work, you know, we sort of in the States, those are 3 different parts of government. There's the environmental stuff. Health and social services are sometimes together, but depending on the social services, food and so on, it can be separate. Some countries are very good at triage. Like, you know, if you're sick, you go here. If you're not sick, you go here. So sometimes they're bad. Like, you know, everyone would rush, you know, Sophia was telling me everyone would rush to the A&E. And the problem is that crowds the A&E, and it's hard to tell apart who really needs the A&E from who doesn't. And the same thing is true in the States. And we had no ability to provide social services. So I just think it's worthwhile noting that all these big challenges involve enormous parts of government. And so that requires not only that each agency do well, but that each agency be interacting with other agencies well. And then the other thing I'll say is there's sort of, if you will, short-term problems and long-term problems. And so short-term problems are, there's a COVID outbreak, what do we do? Which is like hugely, hugely important. And then unfortunately on the US agenda, that often pushes aside the long-term problem, like, you know, 50 years from now, the sea is going to swallow southern Florida. by the way, we have, lots of people who live there, and what are we going to do? And, as best I can tell, global warming is going to threaten parts of Hong Kong and Jakarta and Shanghai and Mumbai and all of Bangladesh and vast parts of India and probably several other places that I've forgotten to list. And so there's then a sort of long-term adaptation, like how are we going to go about getting ourselves from here to there? When people talk to me about stupid policies in the US, I often say, well, it's hard to believe we'll still have the same stupid policy in 2050 that we have today, but it's hard to know exactly how we will not have that same stupid policy between now and then. It just seems implausible that we'll keep doing stupid policies forever. So it's sort of like, how do we go about incorporating the short-term thinking and the long-term thinking? Good governments, like the bread and butter of a good government is handling the short-term problem. You got a COVID outbreak, how do you handle it? And governments rarely get graded on how they handle the long-term problem. At least in the States, they rarely get graded on how they handle the long-term problem. And that's something that I think is going to require a different way of thinking about stuff. So there are all these sort of challenges about health of cities and so on that are going to require, I think, a new way of having the government and the private sector work on stuff. So those are just a few of the comments that struck me from the panelists, which I really enjoyed.
So I want to kick off the Q&A with a question that I think anyone here could contribute a great deal to. We've spoken a lot about the things that we can do to make the city a more resilient place, a place that's more prepared for the future. One of the things that we've discussed a little bit less is the cost. So how do we pay for all of this? One thing that struck me, David, in your book, was your discussion of how after cholera was a pandemic in London and other places, what it really took for cities to pull themselves together to provide clean water to every building, not just clean water coming in somewhere, but clean water reaching everyone, how to provide sewerage to everyone. And of course, the pandemics we've dealt with in our lifetimes are a bit different. So the kinds of problems that we have to resolve are different, but it's still a monumental task, some of which we can do right away and some of which will take many, many years. Right, so there's that kind of long run investment. There's also short run investment, there's short run cost. So if we talk about all of the things that Hong Kong had to do in order to address the pandemic in the short run, we talk about quarantines, we talk about isolation, restriction testing, where you lock down a whole building for a day. Those things have costs. And so I guess I'd also be interested to hear from the panelists, what do we learn from our experience in terms of how to do these things more efficiently, get better results with a smaller cost to the people who live in the city and who live through those events? So I'll open it up to anyone.
I'm the first one that can give an easier answer. Okay, I think that my philosophy is that how to live and work in a more efficient way, but with the less carbon footprint, right? We have to consider about like immediate or short-term challenge like the pandemic, but how to decarbonize, right? So I think most of you should be used to using Zoom for working and communication, right? In these days, after or during the COVID, that is an obvious answer adopted in Hong Kong and elsewhere, right? So I think that I said that we try to learn from a crisis. So I think that Zoom meeting, use of technology, that no matter I'm at home or in the office or on an MTR, that we can use Zoom to attend meetings locally and globally. So this is one of the examples that I think we all learn from the crisis, right? I think we can also consider other similar examples. And I can add another example is that in Hong Kong, we try to reduce waste because waste is not only about landfill, but also about decarbonization. In Hong Kong, in the past 3 to 4 years, that we developed the so-called 綠仔鋪 the number 6 recycling stores. Okay, some of you try to support that. Actually, that also tried to help address the health issues because it was developed about 3 to 4 years ago during the pandemic period. But you know, recycling would involve contact between persons and the contact or transfer of materials from one people to the others. That could be an agent for spreading the disease. So during the period, we actually upgraded the operation and design, architectural design of the number 6 stores, right? When it's closed, that we would have UV light to sterilize the interior space. And we also make the operation to be self-service. Nowadays, when you go to a number 6 store, you can do your recycling, get the amount recorded, and then you can do the own recycling by your own without having interactions with the workers there. So actually, in our architectural design and operations, we try to learn from the crisis and make the operations more efficient, healthier, and more cost-effective. There could be many more cases. Okay.
Okay, so I think it is not easy, especially, you know, it depends, cost depends a lot of factors and how you look at it. For example, the economy of the society, you know, what is the status? So cost means differently at different stages and also different context. But of course, you know, one easy way is to think about reducing cost. But I think in terms of reducing costs is also, you know, put us, you know, into challenge as to when we sort of have one measure or one initiative, whether this is a cost-effective measure or not. So, for example, if I use, you know, pandemic as an example, you know, at the time we do a lot of testing. And testing is very expensive. Many countries actually do not test. And if they do not test or do not test so many or so much, then, you know, they wouldn't know whether there is a case or not. So there is a lot of sort of, you know, hidden, you know, the number of cases is not entirely sort of in par in terms of comparison. But you know, at the time, there was a lot of noises about universal testing. So we have to think hard, you know, whether universal testing can really mitigate the risk or reduce the risk, or is actually very expensive, but just responding to some of the sort of, you know, political outcry, if I may say. So I think all these are, you know, job of a politician as well, if you think about how to reduce cost.
If I may supplement on this question on cost, how to finance and build resilience, I think from a building perspective, since majority of our working times actually will be in buildings, and how we can make sure the buildings we design, construct, eventually will stay for 50 or more years, will be resilient is a big question for the industry. And how to finance it? Well, these days, when we go back to the certification standards, well, they are changing with an additional requirements on a roadmap. They ask for a roadmap for climate resilience action plan. They ask for a life cycle assessment of your buildings in your projected life cycle, how much you need to maintain, how much carbon probably it would emit. And then for these actions, well, you need to disclose it. Well, you may not be held accountable, but as long as you disclose it, you somehow have to stick to your words. And somehow, well, if you are asking for investment, green finance as an instrument to, well, probably to get some of the funding, well, you need to demonstrate you have a good performance so people measure and somehow repeat and certify their buildings to make sure that to demonstrate to potential investor that well, my buildings actually is insurable, is investable, so they can attract the funding they need. And we all know that the green finance sector actually is growing in a very, very fast manner. I hope that, well, in the future, it would be, well, even, well, a bigger for us. But I guess the disclosure, the action plan, and the life cycle assessment is the key. And we need to measure what we do in every steps. So, one point I would like to further elaborate on some of the Hong Kong unique strength is Hong Kong U together with CU and Hong Kong UST, well, they have a joint research which look at future climate scenarios. And those scenarios and those data now can give us practitioner different climate scenarios, even down to a building site level. And then we can tell which location of Hong Kong is more vulnerable to certain physical risks. And then that really help us in assessing, well, the future in our life cycle assessment and climate resilience assessment.
From a public economics perspective, that is, how do you pay for things through the public sector? Rich people always pay for poor people. So it's just poor people don't have the money to pay for stuff and rich people do. So rich people always pay for poor people. If you say to rich people, would you prefer not to do that? Would you prefer not to pay not to pay higher taxes and therefore not to have services that benefit low-income people? In the short term, sometimes they say yes, but then what happens is as things deteriorate, they notice the deterioration in the quality of everything and the population response, and then they leave. So the only answer is, I'll do it, because the alternative is too terrible to think about. And you sort of see people say that, like, yeah, I'll pay for higher property taxes to make there be more money for schools, because we got to have an area where kids are in school and the schools are good, because otherwise it's just not going to work for us. Where governments, at least in the US, get in trouble is where they try to do too much. So they do it inefficiently. So they're wasting a lot of money. Or you say, I'm going to tax rich people. So the US has a problem where we say, we'll tax rich people, but only the rich people who live in the center of the city. If you live a little bit further out, you don't have to pay that tax, even if you're rich. So, okay, well, now you've just created a loophole big enough to drive a cruise ship through, right? Because you just move out a little bit. So if you have a big enough area that people won't leave too much, then you can do that. And this is sort of why I come back to, in my mind, the quality of the public sector is going to be extremely important. And it's much more important the more mobile the population is and the more varied the challenges are. And I think both of those are rising. We're getting more varied challenges and we're getting more mobile population. So the quality of government is becoming even more important.
I think there could be some change that could be made where it's cost neutral. So you could have choice A and choice B, and choice B could be much better, but cost the same as choice A. And an example would be on the work that I showed, there was one building type, one design, no matter where it was in Hong Kong, New Territories, Hong Kong Island, Kowloon, it always did well. That design always did well. And it didn't matter if it was the beginning of the pandemic, the middle, or the end. At the peak, it did just as well as other points. But that building doesn't cost any more than any other building in Hong Kong. It does take up a little bit more land. So there is a cost because land has a cost. But if we're thinking about how we export our models, Hong Kong, keep in mind, was the second major population in the world to completely urbanize. So we have a lot of experience the rest of the world does not have in high density urban cities. We have decades of experience more than the rest of the world. We have a lot of knowledge, the testing that was in our hands. And I'd add a fourth variable to the benefits of the testing that was done, which is that we can now see which buildings did incredibly well through the sewage testing and which buildings did not. And I have a lot of that data that I couldn't show today because it's very confidential data. But what it says is a very clear story, time and time again, that some buildings are much better than other designs that cost the same. So what I would add is that we have a responsibility. The responsibility that we have is we have the data, we have the knowledge, we need to share the knowledge with the right people so that we can then build the best cities possible going into the future, which then benefits the world. Because we travel so much, if we're only looking at it from the point of view of Hong Kong or the point of view of the US, well, I travel to the US a lot and people from the US travel here. We're impacting each other. In Asia alone, over a 30-year span, we will urbanize people being born in the city or people moving to the city, 1.3 billion people, or sorry, 1.1 billion people, according to the UN numbers. So we have a vast responsibility to build the best buildings possible, because those buildings will last decades, could even last 100 years, to build the best buildings possible for that 1.1 billion people. And that itself would be one of the best services for the world. But it doesn't take that much of a cost difference. So that I would come back to cost. It's really a design difference.
Great. So I think we should definitely open the floor to the audience at this point. Yes, you've got microphones. Great.
Hi, I'm Curtis from our Hong Kong Foundation. I am a policy researcher in healthcare and social innovation. So first of all, thank you for the sharing so far. I do have a question about the public side of things. So you did say about, air ventilation being a very important thing, air permeability being a very big thing. I think I can speak for most of the public that I'm not very familiar with these terms, and I think a bit of public education would probably benefit us. At the same time, I know that these are very obscure topics that it would probably be very difficult to teach in a school, like how to open a window or, how do you make sure the air quality at home can be more useful? Because as Eric did say that, opening the right, sometimes you're not opening the right windows, and that could be a problem. That could be counterproductive. So in terms of the public education side, how would what do you think are good ways, to teach these architectural solutions? And also on the architectural side, I do wonder about the standards. Whether you think these standards are relevant also for public spaces, because I think if we want to encourage people to stay, healthy, but at the same time you want them to be in outdoor spaces where transmission might be risks may be greater. How do you what are the standards? How relevant are the standards in ensuring the adaptability of these spaces to extreme weather risks or health risks? Thank you.
We listen to more questions and then we can respond in one go.
Yeah, let's take more questions. Yeah, let's take a couple questions.
Well, first of all, thank you for your very inspiring information. I'm Jörg. I work at an indoor environmental company, and I just want to supplement this because this is funded by the Jockey Club, and the Jockey Club also funds the Energy Saver project for schools, which has just been extended to give 200 local schools air quality sensors to basically teach students about the importance of air quality, which I think would go somewhat to this area. My question was actually taken by you a little bit because I thought that awareness in Hong Kong could be improved. I talk a lot with people about air quality because it's part of my job, and I feel like a lot of people feel a bit like, oh, COVID is over. It's not so much of an issue anymore. And I think that we have to try to move this topic more centrist because first of all, there seems to be a misunderstanding that their air quality comes at the expense of energy saving, because we otherwise tell people, well, if you circulate the air, if you keep it in, but there are technical solutions that are out there, kind of heat extraction fans and all this kind of stuff. what are your suggestions to kind of improve the awareness of people and kind of overcome this a bit of COVID fatigue, where people feel like that they don't want to bother with this anymore because for some it was quite traumatizing to go into quarantine or isolation. Penny Bay be kind of one of the trigger points here. Thank you.
Do one more question.
You get it, you get it. Okay. Okay, my pleasure. Thank you. I'm Carol Liu. I came from Chengdu, Sichuan province. I'm for traveling here. So it's my great pleasure to have this opportunity to be here. I'm trying to get a master degree in Hong Kong. I'm just trying, yeah. I will stay here for 7 days. Yeah, nice to meet you. My major is finance and accounting, so I care about the cost of this. How to say? Your sensor. Eric just show us your invents. That's very great. But just you guys mentioned the cost and the benefit. How to balance it? So that's my first question. The second question is Professor David said, who will pay the cost for the environment? My opinion is everyone should pay the cost, especially the wealthy people should pay more cost because they are wealthy. The third question is for Professor. How can I buy your book? That's all my question. And welcome to my hometown, Chengdu, Sichuan province, the home of panda. Welcome all of you. Thank you. Bye-bye.
Okay. So thank you for the questions. Let's, okay.
Okay.
Are we okay for time?
Yeah, last one.
All right, thank you. Thank you for the opportunity. So actually, in 2016, we produced the commissioned report for the Lancet. It's about healthy cities in China. It's led by Professor Peng Gong. He's currently a professor in Department of Geography. So in this study, we actually felt it's a dilemma for us about the Hong Kong case, because Hong Kong has very high density and the living cost is high. But still, Hong Kong has the highest longevity among the world. Still, now it still has the highest one. So we're searching for answers. By now, we're still searching for some answers. We got some, but probably you can share with me some. But my question is, the first recommendation we gave in this report is to have health in all policy, and we suggest to start with health in urban planning and design. But since this published in 2018, we haven't seen a lot of advancement in this regard. So still health is not considered in many places. So my question is, for our panelists, do you believe that health in all policy is kind of fantasy or something that's doable? All right, thank you.
David, David.
I'll be quick so others can chime in. I think a lot of on the health and all, I think we need to think about it, but there are other things as well that people care about, like having, how much they have left for non-health consumption and so on. So there is always a balancing issue in terms of health and all. Like, for example, in the US, we closed works for a while. People were very upset at how long we had closed schools during COVID. I know in Hong Kong, people were upset by how long schools were closed. One other thing I would say is, several people brought up the teaching of folks, which I think is great. Some of our most successful policies just happen in the background without you having to think about it. And so the one that I think about is, in rich countries, all the salt is iodized. So it has iodine in it because everyone needs a little bit of, and you say, well, why do you do that? Like, couldn't you have non-iodized salt and iodized salt? And then you teach people that they should have iodized salt. And then people go to the store and they would know to buy iodized salt. And the short answer is people don't want to think about that. They'd rather use their brain capacity elsewhere. And they just want it in the background to know that I don't have to worry about this. And so I think some of it, particularly with the intricacies of building design, I think some of it, you don't necessarily want to be in a position where you have to teach people. You just want the thing to do what you want it to do. And people don't ever have to know why it does the thing that it does. It just does it.
I couldn't agree more. I think also in terms of the first question, I don't know how to calculate the wind pressure from this side of the building to that side of the building without a computer. And so we definitely need a system that does it for us, that we can't do it individually, but we all carry a phone. So if we're at risk, we should get a notification that somehow something's not right. For years, I carried this during COVID because I was the head of a department that had 750 students. So I had to worry about all 750 students. So I wanted to know what parts of my building were at risk and which were not. And this is just a simple CO2 monitor that I could see. This room isn't so bad, but isn't so good. And it tells you a lot, like these simple numbers. But again, you shouldn't have to carry this. It should just notify you when you might want to open that window or notify you that you want to open that window. Or coming back to it, the building is smart enough to just switch up the ventilation a little bit around there or there. A lot of these technologies actually exist in some of the buildings that were just talked about also that Ronald Liu was working on, where the windows just open naturally when the air quality is good outside, better than inside, and the temperature is also the right temperature. It'll open the right combination for you. You don't have to even think about it. Coming back to cost, that's one of the biggest factors we looked at. That's why we did it in the light bulb, is because the cost is essentially, well, we all need lighting. So the cost is not zero, but not so expensive. If you have a light bulb and you already purchase a light bulb, the extra cost is very reasonable. And that's why we thought about that as a factor, because it's already just a commercial light bulb. To add the wind flow, this is about 80 US dollars, and I think it could be much cheaper if we go up to scale. So let's just say 50 US dollars. And what this does is it tells you where the wind's moving. So you don't need very many of them. If you had 2 or 3 in this one room, that would be good enough. And so we're really thinking about like how to bring that cost down to the floor. Like really, cost shouldn't be the design query. Coming back to design, yeah, it's all the architects take a huge role in this, and yet this is very rare to have 3 architects on a panel talking about health. I mean, maybe it happens more often in your line of work, but I was the head of the department, and there's very little in the curriculum that actually tries to tackle health. And I think architects have an immense responsibility, but we don't shoulder that responsibility very well. And so part of the public messaging is to put more public pressure on the architects to perform better. The architects won't do it without some pressure. So I think some public pressure would be helpful in this regard.
Well, I think I can agree more with what David said about having some things at the background and the intricacies, of it. And David used the example of iodized salt. And for those of you who may remember, in the government, we used to have a committee on reduction reduction on sugar and salt in food. Okay. Yes. And we did, talk to not, it's difficult to change people's behavior, right? Although we try very hard. So we actually are thinking of whether we can ask the condiments company, in Hong Kong and in China, we use a lot of soy sauce. So how about lighter soy sauce? And of course, the company, the condiments company said, oh, yes, we do have, less salt soy sauce, the light soy sauce, but no people buy it. So as a business case, they are reluctant. But what we are suggesting is that, no, you don't need more light soy sauce, but you just put less salt into the soy sauce, into the normal soy sauce. So that's at the background, right? But then they are reluctant because it's competition. So that tells you that we need everybody, in the society to work together in order to get this done. Because if the government have this will, and initiative and thoughts about to do it, but if the business partners, only think about business case, then it is difficult, and of course vice versa. So I think this really reminds me of some of these things which I think is that call for action, that everybody would have to work together in our own little part.
I understand time is up, so I will be very brief. Well, the building certification system I mentioned, it is designed for all buildings, of course, for a reason, because they are, well, something like a commercial label. People pay for it, so they want to make sure that, well, more buildings, can enter, the better. So including public buildings. And in Hong Kong, for public buildings and spaces, they go for these kind of certifications, and they, the policy is if it goes above certain size, it needs at least the second highest rating. So for public buildings and spaces, well, it is almost a must, and it is second highest. But I must say, well, it is like a push and pull. Well, we need to do a bit more if possible, especially for certain public building and space, I would say. It is not all equal. And for certain public buildings, well, we need to invest a little bit more to create that values we want. So it is not just about how much, it is about how much we pay. It is about how much we will create for the value. So I guess we need the mass, we need the market, we need the community to create noise. So we have the impetus to create better certification standard.
Okay, in view of time, 3 very brief response. One is about the public education. You know, we have so many problems: health, climate change, air quality, waste reduction, biodiversity, etc. My experience and learning in the government is that we try to integrate things as a one, so that could be more cost-effective and effective in communications. So climate change is probably one of the burning issues, right? So probably we can dovetail with the public education on climate actions and all these health issues in one go. Then we would have a high chance to broadcast the message. Second is that about the this book again, that actually that document Hong Kong story when we were attacked by SARS. The SARS made Hong Kong rethink our high-density cities, about air ventilation, about the sustainable building design guideline. Always, all those research involved me as an architect and researchers in those days, and helping the government to update the guidelines, regulations, etc. So this storybook document all these, and those standards and regulations not only benefit Hong Kong, but also exported to mainland China, Macau, and even some European and American cities. So this book could be useful. And lastly, actually, this book is not for today's event, because this evening I will attend a book talk at the Hong Kong Institute of Architects. So this book is for the Institute, but I bought 2. Okay, so should we give one souvenir to our Chengdu fan? Okay, so that our message of Hong Kong can be broadcast outside Hong Kong. Thank you.
Okay, so I hope that everybody walks away with a better understanding of the invisible work that is going on in the background to make your city a better place to live, and also a sense of some ways that you could contribute in the work that you do. I know that many of you are in finance, so you're paying for some of this stuff, either as a semi-willing taxpayer or as somebody who actually wants to make an investment in the future. I would love it if we could all give a huge round of applause to our speakers. Thank you, everybody. And thank you for coming. Thank you to Guojun for giving us an environment to put on this event.
Thank you so much, everyone. Shall we take a group photo before we leave? Can just stay on the stage, yeah. Okay. Yeah, we have a panel photo. Yeah.
All right, 1, 2, 3. One more.
Thank you so much. Thank you so much. Thank you, everyone. So this concludes our formal program, but we'll invite you to stay for networking until 6 p.m. And thank you all. We'll see you next time. Have a great evening. Thank you.